Yes po, sir.
Okay.
Yes, sir.
Okay. Thank you. So we will start with the midterm topics. So we start first reticuloendothelial system. So with this topic, we encountered some uh, cells like red blood cells, the WBC, and their functions also. It is a system made up of copper cells of the liver, reticular cells of red bone marrow. Your bone marrow is responsible to develop our red blood cells. If abnormal or any conditions that may result in the bone marrow failure to develop some or RBC. That is why some patient may develop some anemia and leukemia. The system defends the body against hazardous substance by phagocytosis. So this is the action of some our army cells in our body. Na silang mga functions like the macropods, they engulf uh, some invaders, no? Sa atong, but then also those who are waste products sa atong body, ilahang pagawa sa atong lawas. Okay? So we have our army cells, the WBC in our body, responsible to defeat any invaders or organisms that might cause some disease. So without our immune system or decreased immune system, so that is why it may result some disease or conditions sa atong body if mo decrease atong immune system. So wala mo fight, no? So reticuloendothelial system, also known as monocyte macrophage system, mononuclear phagocytic system, lymphoreticular system, collection of cells united by common property of phagocytosis. It is a generalized phagocytic system located in all tissues, especially in those tissues where large quantities of particles, toxins, and unwanted substance must be destroyed. So kung minus ng atong mga macrophage, monocyte macrophage system or mononuclear phagocytic system, tendency this mga unwanted substance pundo ra sa ato ang lawas, no? It's a cellular process for ingesting, eliminating particles larger than 0.5 micrometer in diameter, including microorganisms, foreign substance, and apoptotic cells. The word apoptosis is the process of programmed cell death during used during early development to eliminate unwanted cells, used to rid the body of cells that have been damaged beyond repair. So ang problem is yung ganitong cancer cells, they will not undergo cell death or apoptosis. They will continue to multiply. Manang ma-defeat yun ang atuahang mga WBC or army cells. Phagocytosis found in many types of cells, and it is in consequence of essential process for tissue homeostasis. Without this process, phagocytosis, with the dysfunction of our mga RBC or WBC, so tendency dili man normal kung unsay naa sa ato ang body. The more toxins will increase in our body kay wala may mo eliminate. Blood is the body fluid in humans and other animals. So it is very essential to maintain a normal blood in our body because it delivers necessary substance such as nutrients and oxygen to the cells. Transport metabolic waste products away from those same cells. And albumin is the main protein in the plasma made up by our liver. Helps keep fluid in your bloodstream so it doesn't leak into other tissues. So the function of albumin regulate the colloidal osmotic pressure of blood, carries various substances throughout your body, including hormones, vitamins, and enzymes. So if blue albumin levels, it indicate a problem with your liver or kidneys. So it is included in the diagnosis or laboratory tests if ever there is some manifestation of some liver function or abnormal function of the liver and kidneys. So pH of the blood is the normal pH range. Blood is 7.35 to 7.45, which is slightly alkaline. The venous blood normally has lower pH than the arterial blood because of presence of more carbon dioxide. So in the laboratory also, this is very important to know the pH of our blood and also the temperature and viscosity. Viscosity means thickness or resistance to flow. Blood is about 3 to 5 times denser and more viscous or thicker than water. Color. Color of blood varies with its oxygen content. So kung less ang oxygen, medyo pale ang color. So the arteries carry oxygenated blood. So arterial blood is bright red due to its high level of oxygen. Venous blood has given up much of its oxygen in tissues and thus has a darker dull red color. Remember that your artery is the one responsible to carry the oxygenated blood from your lungs back to the heart. Then it will be pumped through your aorta, the oxygenated blood. So your cells in every part of your body will take up the oxygen and then also the nutrients carried by your RBC. Then it will return back to the veins, pasaka na po, paingon sa imuhang heart with less oxygen already and less nutrient. Because kay nakuha naman sa mga every cell sa ato ang body. Then amount, blood consists about 20% of extracellular fluid, amounting 8% of total body mass. Then total volume is 5 liter to 6 liter. In average size adult male, 4 liter to 5 liter. That means 1.2 gallon. In an average size adult female. So we could determine mga stab wound, grabe na ang blood loss, no? So we could determine ubos na gid ang blood, so need blood transfusion. Sometimes we have to double ang IV, no? Mga gunshot or traumatic stab wounds. Because less na kayo ang blood sa body, so therefore less na po ang oxygen nga mo carry, less na po ang RBC that will carry the oxygen and nutrients. So tendency, some of your organ may collapse due to lack of oxygen. Like hypovolemic shock. So in your blood, do you have blood composition, 55% plasma, and this composed matrix of water, salts, proteins, and about 45% cellular elements like RBC or red blood cells, 5 to 6 million RBC per ml of blood. So your RBC contains hemoglobin, which transport oxygen and carbon dioxide. Your blood cells, or WBC, or the army cells, contains 5,000 to 10,000 WBC per ml of blood. It plays essential role in immunity and defense, meaning they are the army cells. Lymphocyte, T cells, and B cells. We have macrophages also, phagocytes that carry the phagocytosis. Granulocytes, neutrophils, basophils, and eosinophils. Now, these white blood cells, no, during laboratory, we could determine also what is really the cause of the conditions based on the laboratory result. Pag-increase WBC, meaning there is infections. Now, we have to determine unsa increase. Ang lymphocyte ba, macrophages, granulocytes, neutrophils, or eosinophils. Based on this increase, we can determine either bacterial, viral, or some other conditions. Platelet, cellular fragments, 250,000 to 400,000 per ml of blood. And it is very important in blood clotting. So decreased platelet tendency may result to internal bleeding, just like patient with dengue. Mo decrease ang platelet. Any conditions that may decrease platelet may result to massive bleeding because dili naman makaporma siya og clot because kung masamad gani ka, so mo to na dito ang platelet sa so na portion na isamad, then mo nang mo form siya og clot. But for those who have conditions na abnormal ang clotting factors, so we could say nga, dugay lagi mamuklat mo. Maybe there is something wrong with your clotting factor. Ano siya? Composition of blood. As a whole blood, it contains plasma. So the plasma, it has amino acids, nutrients, proteins, nitrogenous waste, electrolytes, and gases. And the proteins composed of albumins, fibrinogen, and globulins. And then form elements also, we have the leukocytes, platelets, and erythrocytes. So leukocytes, we have what we call granulocytes, the neutrophils, basophils, eosinophils. And agranulocytes, we have lymphocytes and monocytes. They are the WBC. Erythrocytes is the RBC. So granulocytes are a type of white blood cells that has small granules. It contains proteins. So neutrophils, eosinophils, basophils. So granulocytes, specifically neutrophils, help the body fight bacterial infections. Muna in laboratory, increase gani ang neutrophils, meaning there is bacterial infections. So mga eosinophils, mga worm. Okay? So we could determine what really the cause by doing some CBC mo nang CBC, UE, pag may fever. A type of immune cells that has granules with enzymes that are released during infections, allergic reactions, and asthma, the granulocytes. Because that is their functions, no? To get rid of any invaders, a foreign substance in our body. So this is a picture of granulocytes. Neutrophil, eosinophil, microscopic picture, no? Basophil and mast cell. So assessed immune system contains granule, and they are developed in bone marrow. Now, again, if there is some problem, bone marrow disorder, failure to develop this granulocytes, like chronic myeloid leukemia, infections like bacterial, autoimmune disorders like rheumatoid and arthritis. Granulocytes, like lymphocytes and monocytes, are type of white blood cells that lack visible granules. You can see in the picture, they have clear cytoplasm, allows for better visibility of the nucleus. Again, they are also important to the parts of body's immune system. Another microscopic picture of some cells. So again, plasma have 55% in blood. So it contains water, major function, solvent for carrying other substance. It contains also salts like sodium, potassium, calcium, magnesium, chloride, and bicarbonate. So the function or major function of salts, osmotic balance, pH buffering, and nerve and muscle functions. Okay, og less kag potassium, tendency, weak pod ka. Now, we have to maintain salts in our body. Na kung mag-diarrhea ka, so we have to replace whatever lost. Plasma proteins, fibrinogen, immunoglobulins also function, osmotic balance, and pH buffering, and also fibrinogen for clotting, and immunoglobulins or antibodies for immunity. And then substance transported by blood, nutrients like glucose, fatty acids, vitamins, waste products or metabolism, respiratory gases like oxygen and carbon dioxide, and also hormones. So plasma carries the blood cells around the body, carries dissolved nutrients, hormones, carbon dioxide, urea. Also distributes heat around the body. The RBC or the erythrocyte, transport of oxygen, contain mainly hemoglobin, which loads oxygen in the lungs and unloads it in other regions of the body. Your WBC, we have lymphocytes, phagocytes, and platelets. Again, lymphocytes produce antibodies to destroy microorganisms, and some lymphocytes persist in our body after infections, give us immunity to a specific disease. Ano ilang function sa lymphocytes? Kung masakit ta, then makaagi na ta, di na ta matakdan. Phagocytes engulf bacteria and other microorganisms that have infected our bodies. Platelets release chemicals to make blood clots when we cut our cells. So this is the picture of your blood vessels. Have three layers. This is where your white blood cells, red blood cells, platelet pass. Di siya muagi. So if ever there is vasoconstriction, so meaning less ang agianan sa atohang mga WBC, RBC, and platelet. No? So tendency it may increase out of blood pressure. So the layers of our vessel wall, it contains tunica adventitia, tunica media, and tunica intima. Now, what is the mechanism of formation of foreign elements? Through the process of what we call hemopoiesis. The foreign elements of blood continually produce, replacing relatively short-lived erythrocytes, leukocytes, and platelets. So our blood cells, no, mature na siya. But before na siya mawala, mo-replace po na siya. Hemopoiesis begin in the red bone marrow with hemopoietic stem cells that differentiate into myeloid and lymphoid lineage. So damage again to our bone marrow may result to failure to replace our blood cells. Before birth, hemopoiesis, production of blood cells and platelets occurs primarily in liver, spleen, but some cells develop in thymus, lymph nodes, and red bone marrow. So what is erythropoietin? Also known as EPO, a hormone that the kidneys produce to stimulate production of maintenance of crucial red blood cells. That is why if there are some kidney failure to produce erythropoietin, so meaning your red blood cells cannot be matured. Maintenance of crucial red blood cells. Erythropoietin. So damage sa ato ang kidney because we take some mga medication like NSAIDs, no, mga pain reliever, or any medication that can cause damage sa ato ang liver or sa ato ang kidney. So erythropoietin, the hormone stimulate bone marrow cells to produce red blood cells. So mo nang tendency nga pagdaot na ganing kidney, mag-dialysis because the toxins dili mapagawas, no? And also tendency the patient may have blood transfusion because dili naman mo mature ang ilahang RBC. So what are foreign elements? Are cells and cell fragments suspended in the plasma. Three classes of foreign elements. We have erythrocyte, leukocytes, and thrombocytes. So other name for platelets is thrombocytes. That is why pag decrease ang platelets, it is a term thrombocytopenia. So what stem cell give rise to all foreign elements? We have myeloid stem cells. Give rise to all other foreign elements including erythrocyte, megakaryocytes. The megakaryocytes produce platelets, myoblasts, lineages that give rise to monocytes, and three forms of granular leukocytes like neutrophils, eosinophils, and basophils. Yes? Sa ka man nga time sila mo? Very late na kayo mo login. Let's continue. Hindi naman tamo sa kay jeep. Myeloid stem cells derive from hematopoietic stem cells. They are differentiated into erythrocyte progenitor cells that form erythrocyte. Also, thrombocyte progenitor cells forms platelets. Granulocyte, monocyte progenitor cells forms monocytes, macrophages, neutrophils, basophils, eosinophils, and dendritic cells. So again, what is the function of the RBC or erythrocyte? Na hindi kasulod? Rasa naman eh. To the body tissues and carbon dioxide as a waste product away from the tissues and back to the lungs. So after delivery of oxygen and nutrients to other parts of the body, again, the deoxygenated blood pass into the vein. So asa siya nga part mosulod sa ato ang heart. Pabalik sa atong heart, deoxygenated blood into the superior and inferior vena cava. Okay? So going to right atrium. Okay, so hemoglobin, important protein, red blood cells that carries oxygen from the lungs to all parts of the body. This is a protein produced by your bone marrow that's stored in red blood cells. So, say pasabot kung low imong RBC. This may result to anemia. Okay, through low red blood cells count or anemia can cause feelings of fatigue and weakness. Why? What is the reason? What is the reason why if you are anemic, you have feelings of fatigue? And me, I call in is Jade, 12%. What is the reason? Wala. What is the reason why if you are low, sa ilag ko? Di ko maklaro. Again, okay, so what is the reason when low blood count or red blood count may develop feelings of fatigue and weakness? Yes, yes, yes. That's right. No? Because that is their main function. So low red blood cell count, low oxygen and nutrients to the cells, your body may feel weak and feeling of fatigue, no? Because of low oxygen and nutrients. When people have low red blood cell count than normal, their body has to work overtime to get enough oxygen to the cells. So with this type also of conditions, patient may develop some heart problem because the reason for that is mupump maayo ang ilahang heart because some parts ilang body will dictate the brain, tell the heart to pump more blood. We need more oxygen. So ayo ang oxygen, so tendency to develop ang heart problem. May kasagaran ng complication. So just like mga diabetes, no? Kay more sugar sa ilahang blood, so less ang blood circulation, so the heart pump more or work more in order the cells in other parts sa ilang body. So the cells contain hemoglobins, protein that carries oxygen around the body. So according to Leukemia and Lymphoma Society, the normal RBC range main is 4.7 to 6.1 million cells. Pregnant is 4.2 to 5.4 million microliter. And normal RBC range for children is 0.4 to 5.5 million microliter. Let's go to about WBC. It is responsible for our immune system or white blood cells, also called as leukocytes or the cells of the immune system that are involved protecting the body against both infectious disease and foreign invaders. Now, in mga patient with cancer or in mga HIV or fulminant HIV, the AIDS, no? grabe ka-decrease ng ilahang immune system. Muna matakdan gina sila sa unsa nga sakit. Even sakit sa langgam, mga birds. Common kay sila ha, mga fungal infections, common because of decreased immune system, decrease ang ilang army cells. So sometimes sa medication, it will be based sa ilahang T lymphocytes. Kung decrease kayo yung T lymphocytes, mag-change na po medication. And also, any diseases will be kuan sa ilaha, matakdan sila based sa number of T lymphocytes. Kung decrease na gyud kayo. So all white blood cells are produced and derived from multipotent cells in the bone marrow known as hematopoietic stem cells. Remember that if there is increased WBC sa blood test, it may signifies that there is something wrong or maybe there is something infection. Because if there are some foreign body in your foreign organisms in your body, so tendency mag-multiply po niya itong WBC in order to defeat that foreign invaders or microorganisms sa ato ang lawas. Muna madaghan po siya. Okay? So, pag laboratory, increase WBC. That's the reason. Meaning, ga-fight ang imuhang immune system. No? Muna indication. Kaya kung low na imuhang immune WBC tapos nagkaluya ka, meaning decrease ng immune system, wala na ga-fight. Just like, as I said, mga AIDS patient. Maski wala na sila fever, pero gaga-decrease na ilang immune system. So normal value of WBC, normal number of WBC in the blood is 4,500 to 11,000 WBC per microliter. Normal value ranges vary slightly among different laboratory. Depende sa ilang mga laboratory equipment gigamit. Platelet, also called as thrombocytes, are component of blood whose function is to react to bleeding from blood vessels injury by clumping, thereby initiating blood clot. So, release din siya fibrin, manang mo form na din siya clot, undang na din ang dugo. But for those who have clotting problem, decrease ang platelet or decrease clotting factor, ay diferensya sa ilang blood, laki lang ka clotting factor. So tendency naman tayo ginatawag nga bleeding time. So tendency ang ilang bleeding time increase, no? Supposed to be kana mag-clot nang ta siya, pero wala eh. So meaning that's indication that the patient may have some problems sa ilang platelet or clotting factor. So it is very important to know the history of the patient before surgery. Okay, basi nag-opera ka niya, dugo na ng pasyente. Main function, maintenance of hemostasis depends on three of their particles: the endothelial supporting function of platelets, ability to form hemostatic plugs, release lipoprotein material, the platelet factor 3. Also, coagulating factors are proteins in the blood that help control bleeding. You have different coagulation factors in your blood. Think factor 1, factor 2, 3, 4, 5, 13. And then you get cut or other injury that causes bleeding, your coagulation factors work together to form blood clot. This process is called coagulation cascade. There are tiny blood cells that help your body form clots to stop bleeding. So one examples of coagulation factors and their common names. If one of your blood vessels gets damaged, it sends out signals to the platelets. Platelets, tabangi mi diri kana of damage, they form a plug to fix the damage. So kung low imong platelets, less po ang clotting formation. So following are coagulation factors and their common names. Factor 1, fibrinogen. So deficiency of this factor also may result to abnormalities sa clotting formation. Factor 2, prothrombin. Factor 3, tissue thromboplastin or tissue factor. Factor 4, ionized calcium. Factor 5, labile factor or proaxillerin. Factor 6, anazyme. Factor 7, stable factor or proconvertin. Okay, mga factor 8, factor 9, 10, 11, 12, 13. So common fatty factors, we have factor 10, the Stuart-Prower factor. proacceleratin, the 5, prothrombin 2, fibronidin 1, fibrin stabilizing factor, factor 13. The eponym Stuart Prower factor, factor 10, is an enzyme of coagulation cascade. It is a serine endopeptidase synthesized in the liver and requires vitamin K for its synthesis. Damage to your kidney may result to this deficiency of factor, clotting factor. So that is why magdugo po or the patient may need some vitamin K. The intrinsic fat will consist of 1, 2, 9, 10, 11, and 12. Fibrinogen, prothrombin Christmas factor, Stuart Prower factor, plasma thromboplastin, and Hitchman factor. Intrinsic fat weight. Kaganina, common fat weight factors. So the word fibrinolysis is a process that prevents blood clots from growing and becoming problematic. So dili ka form of blood clot. Process has two types: primary fibrinolysis, dissolved; secondary fibrinolysis. So in fibrinolysis, the fibrin clot, the product coagulation is broken down. So primary fibrinolysis refers to normal breakdown of clots. Secondary is the breakdown of blood clots due to medical disorder, medicines, or other causes. This may result to cause severe bleeding, just like patient taking some mga aspirin. Tama na, medicine, no? Medical disorder or medicine or other cause. Secondary fibrinolysis. This may result to decrease sa iyang platelet that may cause severe bleeding. Munang contraindicated sa patient with dengue ang aspirin. So the most commonly used clot-busting drugs, also known as thrombolytic agents. Ano sila, no? Use clot-busting drugs, thrombolytic agents, eminase, ritabase, striptase, TPA, TNCase, abokinase. These are example. Let's go to about human blood group and blood type. Group into 4 types: A, B, AB, and O. And each letter refers to kind of antigen or protein on the surface of red blood cells. Ano ma-determine ka nga, A plus ka, B plus, AB, or O plus. So for example, the surface of blood cells in type A blood has antigens known as A antigens. So blood group is determined by the genes you inherit from your parents. But this is not really used in the kanang sa cortic to identify nga imo bagit siyang anak, no? Because if you can see, the AB plus can produce a child A, B, and AB. Unlike DNA test, isa ra gyud siya, no? Maka-kuan siya confirmation. Unlike this ABO typing, dili kay siya. Okay. So possible blood type of a child. If the parent AB and AB, so it could produce A, B, and AB. For AB and B, the same. A, B, and A. For AB and A, the same. But AB or O, it could be A or B. For B and B, parent 1, parent 2, it could have O. So take note, no? B and B, it could have produced a child type O or B. For A and B, both. It could produce O, A, B, and AB. For AA, it could produce O or A. For O or B, it can produce O and B. For OA, it could produce also OA. For O and O, only O. Okay? Yeah, both parents are O and O, and they have some child A. Huwag niyo ma-question. ABO system is the most familiar way of grouping human blood types. So it is very important, especially in blood transfusion. No? The universal donor is the O, universal recipient is AB. Blood consists of cells and yellow watery liquid known as plasma. Blood group depends on what each part of the blood contains. Two main blood group system is ABO, antigens, and rhesus antigen, or the RHD antigen. You heard, no? Uh, Positive RHD antigen. So donor and recipient based on the blood type. Again, as I said, O is the universal donor. It can donate sa O, A, B, and AB. Ang A, it can donate only to A and AB. Ang B, to B and AB. Ang AB, AB regular. Okay? So AB is the universal recipient and O is the universal donor. Let's go to about cardiovascular system. So it is composed of your heart. Okay? So that is your superior vena cava, the upper, and the lower is inferior vena cava. It is where the deoxygenated pass paingon sa imong right atrium. So, agi sa imong right atrium, it will pass into the tricuspid valve into the right ventricle. And that is the largest artery, the aorta. It is an organ system that conveys blood through vessels to and from all parts of the body, carrying nutrients, oxygen to tissues, and removing carbon dioxide and other waste. It is a closed tubular system in which blood is propelled by a muscular heart, meaning pump. So, it is very important to maintain a healthy heart, no? Para insakto po ng iyahang pag-pump, pag-deliver sa atuang blood and nutrients. So, composed of heart, it pumps blood through a closed system of blood vessels. Heart composed of mostly cardiac muscles, also called as myocardium. Functions, transport nutrients, water, gases, waste, chemical signals through the body. Okay. If you can see in the picture, no? The oxygenated blood passes to the inferior vena cava, superior vena cava, into right atrium. Okay, dayon passes into tricuspid valve to right ventricle. Then moadto dayon siya sa pulmonary artery, paingon sa imuhang lungs. Mukuha na siya oxygen dito sa arterial sa alveoli, no? Alveoli sa imuhang lungs, that is the place where exchange of gases takes place. Release of carbon dioxide, and pag inhale nimo, the blood will take the oxygen. Then mubalik din siya sa pulmonary vein. Okay, dayon into the left atrium. Dayon, it will pass into the mitral valve, and then left ventricle. Then paingon dayon siya sa imuhang aorta. Okay? Naitulog kuan sa aorta nga agian, mo na mo distribute na dayon siya sa imuhang body. So there are so many different defects sometimes may happen sa imong heart. Like for example, ang imuhang tricuspid valve, no? Dili siya mo close. Pirmira siya naka-open, so there is a backflow of blood. So dili makakuha paingon sa imuhang lungs ang blood, magpundo, mo backflow. So we have right chambers and left chambers. Okay. The right chambers composed of right atrium and right ventricle, and left chambers we have left atrium and left ventricle. Okay, so the heart has 4 chambers, 2 atria and 2 ventricles. Right atrium receive oxygen, poor blood, meaning deoxygenated blood, poor oxygen because nakuha na ang oxygen gikan sa imuhang other parts sa imuhang body, nibalik sa paingon sa heart through the right atrium. Okay, from the body and pumps into the right ventricle. it will passes to tricuspid valve. Then right ventricle pumps the oxygen for blood to the lungs. Then the left atrium receive oxygen-rich blood from the lungs and pump it to the left ventricle. Okay? Okay, left atrium. Then left ventricle na yun. Left ventricle pumps oxygen-rich blood to the body. Paingon sa imuhang aorta, then to the other parts sa imuhang body. So atria means receive blood. Ventricles pump blood. So right atrium receives blood from the superior and inferior vena cavas and the coronary sinus. Then blood then moves to the right ventricle. There it is pumped to the lungs. So again, mo na siya structure sa itong heart, no? So superior and inferior vena cava, paingon sa right atrium, it will pass tricuspid valve to right ventricle, paingon sa pulmonary artery. Pulmo means lungs. Okay? So dito ang blood paingon sa pulmonary artery, paingon sa imong lungs. And then mubalik siya na may oxygen paingon sa pulmonary vein, buhok, into left atrium. Then sa left atrium, muagi na po siya valve, which is the mitral valve. And then paingon sa left ventricle. Then sa left ventricle, muagi na po siya og aortic valve. Okay? So sa right ventricle, before going into pulmonary artery, naapay isa ka valve, pulmonary valve. Meaning, paingon sa lungs, pulmonary valve. Kaya katong valve from right atrium to right ventricle, it is the tricuspid valve. And then, so nakabalik na, with oxygen na ang blood. No? Left atrium, then it will pass to mitral valve, then left ventricle, then muagi na po siya aortic valve, paingon sa aorta. The word aortic valve kay paingon sa aorta, the largest artery sa imong heart. Okay? That is how blood tracing. Once the deoxygenated pass into inferior vena cava and superior vena cava and coronary sinus. The blood enters the heart through large veins, inferior superior vena cava, emptying oxygen for blood from the body into the right atrium. The right atrium contracts, blood flows from your right atrium into your right ventricle through the open tricuspid valve. So kung ipatrace sa inyo ang blood tracing, no, from inferior vena cava, superior vena cava to right atrium paingon sa lungs. So you have to trace, no, that it must pass sa mga valve. You have to mention. The word pulmonary circulation moves blood between the heart and the lungs. Pulmonary. So meaning it transports the oxygenated blood to the lungs to absorb oxygen, release carbon dioxide. So gikan sa heart, paingon sa lungs. Then the oxygenated blood then flows back to the heart. Systemic circulation means moves blood between the heart and the rest of the body. Nanay oxygen, i-deliver niya sa imuhang system, other parts imong body. Systemic circulation. Portal circulation, they are connecting veins which are additional network of vessels between arterial and venous circulation. Veins between the connected capillaries are called portal veins. Circulation of nutrient-rich blood between the gut and liver is called portal circulation. It enables liver to remove any harmful substance that may have been digested before the blood enters the main blood circulation around the body, the systemic circulation. Damage to your liver, so dili na niya ma-remove ang mga any harmful substance. So mo puyog sa imuhang blood. So this is portal circulation, no? Products of digestions are absorbed into capillaries within the villi of the small intestine. Then digested food molecules then travel through hepatic portal veins to the liver. Then the liver monitor blood contents, and hepatic veins deliver blood to the circulatory system. This is portal circulation. Cardiac output, simply the amount of blood pumped by the heart per minute. is the product of heart rate, which is the number of heart beat per minute, and the stroke volume, which is the amount of blood heart pump per beat. So cardiac output equals heart rate times stroke volume, or stroke volume times heart rate, and usually expressed in liters per minute. So blood pressure. It is important because the higher blood pressure is the higher risk of health problems in the future, especially heart problem. Now, if your blood pressure is high, putting extra strain on your arteries and on your heart may also cause heart attack or stroke. That is why for those who have heart problem, tendency dapat dili sila mahago, because once mag-exert sila effort, tendency mo increase ang ilang heart rate. So, o sa mahitabo, mo pampog maayo ilang heart. Yan na naman sila damage sa cardiomegaly. Weak na ilang heart. So, heart attack. So, blood pressure is the pressure of blood pushing against the walls of your arteries. Arteries carry blood from your heart to other parts of your body. Your blood pressure normally rises and falls throughout the body. So, imagine, if your blood vessels, your artery, ang iyahang diameter ni narrow or ni gamay, so what will happen? Less ang oxygen delivery. So, unsay buhaton ni heart? Because kay nagdemand man og maayo, kay gamay raman ma-deliver because there is narrowed arteries. So, mo pump og maayo si heart. Sometimes, sige siya pump, kapuyo na po siya, no, shutdown po siya. Eh, siya mismo, kulang na po siya og oxygen. So, your blood pressure normally rises and falls throughout the body. Mo ni giniingon nila nga, kuan, traidor nga sakit, no? Hypertension, increased blood pressure, because you could not tell nga kano sa mo taas imong BP. May stress lang ka, wa na. Now, another organ, kidneys, provide a hormonal mechanism for regulation of blood pressure by managing blood volume. So, renin-angiotensin aldosterone system, the kidneys regulate blood volume. If damage sa imuhang kidney, so there is no renin-angiotensin aldosterone system that can control your blood volume. So, tendency, dili ka excrete ang imuhang kidney sa mga waste product, dili ma-excrete ang fluid sa imuhang body, so ma-store siya balik. So, tendency, dili ma-filter, no? So, makuyog lang gihapon sa blood ang mga toxins. In response to rising blood pressure, juxtagranular cells in the kidney secrete renin into the blood. RAS, or renin-angiotensin system, hormone system that regulates blood pressure and fluid and electrolyte balance, as well as systemic vascular resistance. This is what happened for kidney failure. They have increased blood pressure because of this, no? Renin-angiotensin system nila dili na maayo, no? Wala na kay hormone that can regulate blood pressure. So they may develop also heart problem for those who have kidney problem. Is the resistance or peripheral vascular resistance or systemic vascular resistance in circulatory system that is used to create blood pressure, the flow of blood, and also component of cardiac functions. Take note, as I said, when blood vessels constrict, vasoconstriction, these lead to increase in systemic vascular resistance that may result to increased blood pressure. Medyo halap siya. So, na-escape niya. Sympathetic output, increase, decrease in parasympathetic output, that may result to increased heart rate, decreased cardiac output, then increased blood pressure. Listen. So patho, what is the pathophysiology of hypertension? It's an area which attempt to explain mechanistically the causes of hypertension. It's a chronic disease characterized by elevation of blood pressure. We have primary or idiopathic hypertension, or secondary. Primary, you don't know the cause. Karon, taas akong BP, but later, dili na po. No? But secondary, there's really other organ involved. Secondary factor. Like kidney failure. or so other abnormality that can cause increased blood pressure, hypertension. So pathogenesis of essential multifactorial and highly complex. Kidney is both the contributing and target organ of hypertensive process, and the disease involved in interactions of multiple organ system and numerous mechanisms of independent or interdependent pathways. Kaliwat, no? Factors that play important role. Hypertension, pathogenesis, genetics, pamana sa atong parents. O sa atong lifestyle, no? Activation of your hormonal system such as sympathetic nervous system, adrenergic, angiotensin, aldosterone system. Kuyawan ka, kalit lang dahil ka increase mong heart rate, taas mong BP. No? But later on, the opposite effect, pag ma-relax na po ka, mubalik sa normal. Sympathetic and parasympathetic effect. Obesity, may due to complications of obesity also. Increase dietary salt intake. No? It will, kuan niya, ang salt, i-attract niya ang water. No? Muna increase ang imong body fluids. That may result to increased blood pressure. Mano mga mahitabo sa mga kidney failure, no? Dili makagawas ang ilang fluids, they may develop edema, sometimes in severe cases, they may develop anasarca. So edema all over the body. Pero may magtaas pa nilang BP. For those who have patient nga be given sa mga diuretics, no, kay makaihi sila, mo decrease ang ilang blood pressure. Arterial hypertension is condition of persistent elevation of systemic blood pressure. Again, BP is the product of cardiac output and total peripheral vascular resistance. Okay? Product of cardiac output and total peripheral vascular resistance, blood pressure. So hypertension or HTN or HT, no? It depends. There are some doctors, they will use HTN. Some, they will use HTN. Or some, they will use HT as hypertension, abbreviation for hypertension. Hindi sa ila, sa gamit nila. Some, they will use HPN, hypertension. Some, HTN or HT. Also known as high blood pressure or its BP. It's a long-term medical condition in which blood pressure in the arteries is persistently elevated. Kung secondary cause, that's a problem. You need to treat the cause. Okay? But in primary, like for example, nalagay gibuhat, no? Jogging baka ka, itaas mong BP, but after ma-relax ka, wala po siya. But for those secondary, so you have to treat my cause. Okay, if you just give management for increased blood pressure, nya wala nimong gi-manage ang cause, mo gyapon magsigiri gyapon na siya taas. Magsigiri gyapon inom. Take note that in constant taking some mga maintenance medicine, okay, mo normalize ang imuhang blood pressure, but later on we don't know what is the effect of that prolonged intake of that medication. It might cause some damage sa imong kidney or sa imuhang liver. Okay, when you are stressed, your body sends stress hormone like adrenaline, an adrenaline rush, no? And cortisol into the bloodstream. Makuratan ka, marakag na. Kuan, so adrenaline rush into the bloodstream. So increase imong kuan, no? Blood pressure. Pupusgan ka. Kay grabing oxygen, imong mga blood cells, nutrients. And imong heart mo pump, pusog. Causing your heart to beat faster and blood vessels to narrow. So mo increase ang imuhang pressure because nigamay ang blood vessels circumference. When stressful situation is over, blood pressure goes back to its normal level, as I mentioned. Okay? Kuratan lang ka, taas imong BP, but after ma-relax ka, goes down. But as I said, pero pag na-secondary cause, may problem. You need to treat. There are some blood pressure range, no? It depends. Because some in stage 1, 130 to 139, and diastolic 80 to 89, there are some nga, okay ra sa ila. There is no associated symptoms, no? 130, 89, or even 90. But wala sila bation. But if it is associated with other symptoms, manay kuyaw. Okay? So normal 90 to 129. and 60-79. In 129, sometimes systolic, naiuban nga, lain lang pamati na. Then stage 2, 140-179, diastolic 90-109. Critical, over 180, diastolic over 110. So pag minani mga BP, right away, you have to take your medication. Especially with heart problem. Factors that can raise the risk of having essential hypertension, obesity. So kung obese ka, what are you to do? Exercise. Okay? Dietary control. Okay? Obesity may lead to diabetes also. The same. Lifestyle nimo, nutrition, type of nutrition, control. And stress. Stressful kasi imong trabaho, sa nga trabaho. Insufficient intake of potassium. So we have to maintain normal potassium, calcium, and magnesium. With heart problem, dapat ginamintin nila ang ilahang potassium, calcium, magnesium in the body because tendency pag-increase ang potassium, the more your heart will pump, will work. So, may heart problem, trabaho maayo kan because of rich potassium. So, mag-collapse, mag-heart attack po. Lack of physical activity. Especially magkaon, tulog din diretso. Then chronic alcohol consumption. Another factor. So for stage 1 or pre-hypertension, 120/80 to 139/89. Stage 2 or mild hypertension is 140/90 to 159/99. Stage 3 or moderate hypertension is 160/100 to 179/109. The first figure is the systolic, then ang over systolic. Stage 4 severe hypertension is 180/110 or higher. Okay, symptoms of high blood pressure. There are some asymptomatic. You don't feel anything, even though medyo taas na ilang BP. But indication that your hypertension severe, maybe headache. Sometimes ang headache is due to some conditions nga may mga blood clots sa imong blood vessels sa imong brain. So minus ang daloy sa blood paingon sa other portion sa imong brain. So mo nang sakit ang pamation kay less ang oxygen. Fatigue or confusion due to loss of oxygen or lack of oxygen. Vision problem, the same. Chest pain. Minus na po ang kuan sa imong heart. No? Enlarge imong heart, na minus po niyang oxygen. Nag-start na po ka deteriorate. No? Ang cell sa imong heart, start na kita na sa kuan, laboratory. Ano nga portion, matay na imong heart ring portion, manang chest pain. Difficulty breathing because cannot pump unless ang oxygen distribution. Irregular heartbeat, blood in the urine. Okay, maybe nanay mga kuan sa imong kidney. Pounding in your chest, neck, or ears. Pa-feel gini mong kuan sa imong kuan. Heartbeat. Murag naglisod na gyud, no? Ang imong heart. Over time, lack of sleep could hurt your body's ability to regulate stress hormones, leading to high blood pressure also. Sige bilar. Okay? Sige Mobile Legend. Tiurok. Obstructive sleep apnea may be the cause. Can increase your risk of high blood pressure as well as heart problems and other health issues. Sleep apnea, there is a portion nga wala ka maginhawa. Obstructive sleep apnea. So what will happen? So wala po yung oxygen gihapon. No? Less ang oxygen distribution kaya wala maginhawa. Yeah. It can cause heart problems. Kaya wala mo maadto po sa imong oxygen sa imong heart and other health issues. So the new approach recommended British Hypertension Society is that first-line therapy in patients over 55 should calcium channel blockers or thiazide type diuretics. Ay mga diuretic, pahihiyon lang. Okay? O na dayon, ma-solve na dayon ang problem. Then for patients who are younger than 50, but in thiazide type diuretics, you have to monitor also ang potassium or calcium niya, no? Because it can increase secretion sa imuhang potassium and calcium, thiazide. So with that, you have to shift your medication into potassium sparing diuretics. Kung di mo monitor, ubos na kayo ang potassium. Siguro nagkaluya po ng pasyente. Yan, nakaminos po ng function sa iyang heart, release ng potassium. For patients who are younger than 55, ACE inhibitors are the first-line drug of choice. So you should know what are those calcium channel blockers, thiazide type diuretics, ACE inhibitors, and first-line drug of choice, ACE inhibitors for younger than 55. So these are group of medication that disrupt the movement of calcium through calcium channels, used as hypertensive drugs, as medication to decrease blood pressure in patients with hypertension. So ang iyang effect, mechanism of action, decrease excitability of heart muscles, and are therefore used for treating certain types of abnormally rapid heart rhythm. So these are examples of calcium channel blockers. Be familiarized with this medication, because in board exam sometimes it will come out, they will give the generic name, then you will supply the brand name. So, or the correct combination of the following calcium channel blockers are, so ilang i-interchange ang mga brand name. Kinala isa na correct ang ilang combination. Nana, no? Sometimes, nana may style sa ilang board exam questions. So you should familiarize. So the calcium channel blockers just reduce amount of calcium enters smooth muscles and blood vessel walls and heart muscles. Muscle cells require calcium to contract. So kung decrease yung calcium, decrease po ang muscle contractions. So saan pa niya pag-function insakto, pagpuwang. Pag sobra po, kuyaw po. Okay? So everything in the body in excess is bad. Beta blockers lower blood pressure in the part by decreasing heart rate and force which heart pumps blood. So meaning, different medication for hypertension have different effect and indication. No? Dili kay, okay na siya, mano na siya. Okay? Depende sa cause. So for beta blockers, lower blood pressure in part by decreasing heart rate and force of which the heart pumps blood. Then calcium channel blockers decrease or reduce the amount of calcium that enters both muscles and blood vessels, walls, and heart muscles. Thiazides promote natriuresis and diuresis. 3 thiazides directly commonly used: hydrochlorothiazides, clortalidone, and indapamide. It's HCTZ and clortalidone. They are FDA approved for clinical use in management of primary hypertension. So thiazide type diuretic that increase urine flow. 3 types, we have thiazide diuretics, loop diuretics, potassium sparing diuretics. As I said, if you are giving thiazides, diuretics that can increase secretion of potassium, and you don't want to give potassium supplement, pwede kang potassium sparing imong ihatag. Kung di po nimo i-change imong thiazides, you have to supplement potassium. Loop diuretics, these are the example. Be familiarized. Furosemide is common, being prescribed by doctors. Depende sa doktor, depende sa ahente. Isa mo dool. Kay si Lasix may sig dool sa ako, si furosemide akong i-prescribe. But they are all loop diuretics. And potassium sparing, they are the drugs that do not promote secretion of potassium into the urine. Are used as adjuvant therapy, as I said, together with other drugs in the treatment of hypertension, management of congestive heart failure. So example of potassium sparing, ano siya? Amiloride, again, depende hapon, aldactone, depende sa doktor. ACE inhibitors or angiotensin-converting enzyme inhibitors are a class of medication used primarily for treatment of high pressure and heart failure. Okay, as I said, different classes of medication. have different indication. So angiotensins, good for hypertensive with heart failure. Work by causing relaxation of blood vessels as well as decrease in blood volume, which leads to lower blood pressure, decreased oxygen demand from the heart. So it is good for patient with hypertensive and heart failure. ACE inhibitors. These are example. Captopril, common kayo, enalapril, Vasotec. My mother before, no? Tagaan siya mga ACE inhibitors. Kaya ako, at first, lain doktor, ako pril. Sa lain na po nga doktor pa-check up, na ito na paglaing lugar, kuan, captopril. But there are ACE inhibitors. So following are some of the heart disease medication available. Siya. So various drugs can be used to treat coronary artery disease. We have cholesterol-modifying medications, aspirin, beta blockers, calcium channel blockers, ranolazine, nitroglycerin, ACE inhibitors, and angiotensin receptor blockers, o ERBs. So you should familiarize with sa ito na yung mga tambala, cholesterol-modifying medication, beta blockers, calcium channel blockers. In general, treatment for heart disease usually include lifestyle changes. Kaya posado mo kay ka, kasi mo ka mga fatty foods. So this include eating low fat and low sodium diet because it can attract more water sa imong body with increased sodium. I hope you know the formula of sodium, ha? I heard, nari kuno di kebalo. Getting at least 30 minutes of moderate exercise on most days of the week. Quit smoking. Then limiting alcohol intake. Why limit? Avoid alcohol. Because alcohol also can increase your good cholesterol. And minimal amount. But quit smoking, yun siya. Kaya wag siya benefits. So the big six heart medication is statin. Ang effect to lower LDL cholesterol, the bad cholesterol. Aspirin to prevent blood clots, especially those patient na ay mga clots sa ilang blood vessels. No? Kung gamiton, kanang nag-mild stroke because of clot sa ilang blood vessels, sa ilang brain. Okay? They'll be given o sa ilang heart blood vessels, no, na clot. So they will be given aspirin. And clopidogrel to prevent also blood clots. But sometimes combination of aspirin and clopidogrel in a prolonged intake, no? It must be also monitored because this may result to ulcer. Then pag na kay kuan mag-bleeding mo, pag na ulceration, this may result to internal bleeding. Warfarin to prevent blood clots also. Beta blockers to treat heart attack and heart failure, sometimes used to lower blood pressure. Inhibitors to treat heart failure and lower blood. So tonsils, subclavian veins, thymus, then spleen, lymph nodes, inguinal lymph nodes. So lymphatic system is circular system of fluids. It returns fluid to the blood, removes antigens from the body, and exposes antigen to immune system. Main structures of lymphatic system: lymphatic vessels, lymph nodes, diffuse lymphoid tissue, example tooth cells, lymphoid organs, spleen, and thymus, and bone marrow. It is where our WBC or army cells or immune system passes, no, sa atong lymphatic system. It is a clear watery fluid similar in composition to plasma, with important exception of plasma proteins and identical composition of interstitial fluid. And then transport the plasma proteins that seep out of the pilipids back to the bloodstream. Contains lymphocytes which circulates in the lymphatic system, allowing them to patrol different regions of the body. As I said, mo itong army cells, diha moagi ang atong army cells to patrol different regions of the body. The lymphatic system carry fluid to great veins in the neck, fluid flows only toward the heart, and collect excess tissue fluid and blood proteins. So from lymphatic capillary, smallest lymph vessels, first to receive the lymph. And lymphatic vessels collect from lymph capillaries, then lymph nodes scattered along collecting vessels, then lymphatic vessels, lymph trunk, collect lymph from collecting vessels, and into collecting duct, then lymph ducts empty veins to the neck, to subclavian vein. It is located near blood capillaries, receiving tissue fluid from connective tissue, and highly permeable, allows entrance of tissue fluid, bacteria, viruses, and cancer cells. Manang dito po mo, agi po na nga ito ang army cells. So lactals is specialized lymphatic capillaries located villi of the small intestine, receive digested fats, fatty lymph, or chyle. So this is the location and structure of lymphatic system. So accompanied blood vessels composed of same three tonics as blood vessels, contain more valves than veins, help direct the flow of blood. So lymph propelled by bulging of skeletal muscles, pulsing of nearby arteries, tonica media of the lymph vessels. So your lymph nodes are vein-shaped organs along with lymphatic collecting vessels. So diha i-cleanse ang mga pathogens. That is why during infections, mo enlarge ang atong lymph nodes because our army cells mo multiply. Managhan po sila para to defeat the katong na-collect ng mga microorganisms. Are organized in cluster. These nodes are considered in size. Some are small and pinhead, largest about the size of an almond. The locations atong lymph nodes. We have regional lymph nodes. So sa neck na to naa, sa inguinal naa. Muna panghikapon dayon, enlarge ba o painful ba. So take note, at is a sign also nga your immune system is fighting, no? Pag na-enlarge sa imong node, ito painful, meaning ga-fight ang imong immune system. So fibrous capsule surrounds lymph nodes, trabeculae, connective tissue strands. The main substance of the node consists of reticular and lymphatic tissue, containing many lymphocytes and macrophages, your army cells. A node's concave surface called hilum, where an artery enters and vein and different vessels leaves. So this is the picture of your lymph nodes, microscopic anatomy of lymph nodes. Okay. Lymph trunks. Lymphatic collecting vessels converge 5 major lymph trunks. We have lumbar, intestinal, bronchomediastinal trunks, subclavian trunks, and jugular trunks. In lumbar trunks, receive lymph from lower limbs, and intestinal receive chyle from digestive organs. Bronchomediastinal trunks collect lymph from thoracic viscera. Subclavian trunks receive lymph from upper limbs and thoracic wall. Jugular trunks drain lymph from the head and neck. Spleen. This is the largest lymphoid tissue. It's in the left hypochondriac region, the location of your spleen. Left hypochondriac region in between fundus of the stomach and diaphragm. Yung function of your spleen, removal of blood-borne antigens, removal of destruction of aged or defective blood cells. And also it stores platelets and also function in the fetus for hematopoiesis. Liver and spleen sa infant. Thymus lies in the upper part of mediastinum behind sternum. And weigh about 10 to 15 grams at birth and grows until the individual reaches puberty. prominent in newborns, almost disappear by old age. Function of the thymus, T lymphocyte maturation. Okay. Okay, that is the thymus. Tonsils, simplest lymphoid tissue, swellings form a circle. We have palatine, lingual, and pharyngeal. So that is the location of your pharyngeal tonsil. Palatine and lingual tonsil. So what is the body's line of defense? Skin. We have to clean our skin. We have to avoid nga masamad atong skin because that is the line of defense of our body. Once there is one, there is the point of entry of some organisms inside that may result to infections. Tears, luha. So, okay ra gid mga boys, no? Hilak tag panagsa, no? To cleanse our eyes. Okay? Tears, because it contains immunoglobulin to fight some bacteria and also mucus. Diba? So, kung ubhon ta, there will be increased secretion of mucus. Munay atong mechanism sa atong body to fight against infections. Secretion of mucus. The problem is, to increase ang mucus, maglisod po ta ginawa. But that is the defense mechanism sa atong body. A part of first line of defense in fighting infections. Help to protect us against invading pathogens. Then you have beneficial bacteria growing in the skin, in your bowel, and other places in bodies such as mouth and gut. So it is not good to take sa mga self-medication antibiotic because it can destroy your mga good bacteria sa inyong intestine, sa bowel. So the function of these good beneficial bacteria stop other harmful bacteria from taking over. So first, there are three lines of defense. No? Your skin, first being outer barriers, the skin. Second being non-specific immune cells like macrophages and dendritic cells. Third line of defense being specific immune system made of lymphocytes like B and T cells. Dendritic cells are antigen-presenting cells known as accessory cells of mammalian immune system. Their functions, process antigen material and present into the cell surface of T cells of the immune system, act as messenger between the innate and adaptive immune system. One is dendritic cells. The process of phagocytosis steps. There are a number of distinct steps. Step 1 is activation of phagocyte. Step 2, chemotaxis of phagocytes. Step 3, attachment of phagocytes to the microbe or cell. Step 4, ingestion of microbe or cell by phagocyte. Then process of inflammation steps. So we will continue next meeting. I think I cannot do some any questions, clarifications? So for 5:30.